My name is Tyson Cobb. I'm an orthopedic surgeon. I specialize in hand and upper extremities, so that means everything from the tip of the finger to the shoulder. I went to medical school at Texas Tech, obviously in Texas, and did my orthopedic training at Mayo Clinic in Rochester, Minnesota. I was there for 5 years, and then did a subspecialty training for hand, microvascular, and upper extremity. I went into hand surgery because I like the complexity of the surgery and the variety. So we do more variety than any other surgical discipline. We do microvascular surgery for patients that have had digits cut off or lacerations and so forth. We do bony work for people that have had fractures. We do joint replacement procedures for people with arthritic joints. We do various arthroscopic procedures for joint pathology that can be fixed without a joint replacement. And then we do a lot of soft tissue procedures, so there's a ton of variety in hand surgery. And as you move up the extremity, it tends to become a little less variety, but similar types of procedures. So we repair tendons in the hand and we repair tendons in the shoulder. So for the shoulder, it would be like a rotator cuff repair. We do those minimally invasive through the scope. And for hand, repairing avulsed tendons or lacerated tendons. Probably the most common problem we see in the clinic would be a carpal tunnel. And so that's a nerve compressive problem. And there's two that we see frequently in the upper extremity. The carpal tunnel is a median nerve at the wrist, and the cubital tunnel is the ulnar nerve at the elbow. And both of those are initially treated by splinting, and when splinting doesn't work, we typically move on to surgery to decompress it. Both of those can be done with minimally invasive procedures now. In the old days, it required a big open procedure. That's not true anymore. We can do those through the scope. So a scope is a small video camera that we use to visualize the anatomy through small portals, and the portals are small enough for say, an endoscopic carpal tunnel release that we don't even need any stitches. So we just close those up with a little steri-strip, which is a little piece of tape. Most of the patients are using their extremities the day after surgery